Hello friends, so today we would be seeing about asbestosis, the important questions that are asked on this topic. So asbestosis is an occupational lung disease which is seen in workers working in shipbuilding industry, construction, cement, all these industries, even mining. So there are various types of asbestos fibers. The ones which is the most carcinogenic. So you get a question, which is the most carcinogenic asbestos fiber. So remember, most carcinogenic is Ca, that is crocodylite type, and even in crocodylite type it is the amphibole type which is the most carcinogenic, which is called as blue asbestos. So carcinogenic is Ca, that is crocodylite amphibole type, is the most carcinogenic asbestos fiber. So radiologically, what are the findings that we see in asbestosis? The most common findings are calcified pleural plaques. So you get pleural plaques which are calcified, and important to remember is that the pleural plaques, it affects the parietal pleura and not the visceral pleura. Most common affected are the lower lobes in asbestosis. As the disease progresses, upper lobes are also involved, but initially it is the lower lobes. So here on this chest radiograph, you see this calcified pleural plaques. White indicates calcification. It is affecting the lower lobe pleura, the diaphragmatic pleura. So those are the pleural plaques. We see this pleural plaques here as well, the calcified pleural plaques, which are seen en face. So the most common finding is the pleural plaques. Now this is what you see on this CT chest mediastinal or soft tissue window. Here you see the pleural plaques, the plaques which are thickened, the pleural thickening with calcification. This is another pleural plaque which has this white calcification. So those are the calcified pleural plaques. We see it here as well on the CT scan. Apart from that, what we see is, now this pleural plaque which you see here, it has this irregular nodular margin. So the pleural plaques on chest radiograph, when seen en face, they have this appearance like a holly leaf. This is how a holly leaf looks like. It has this irregular nodular margin. So these pleural plaques, they resemble the holly leaf. So it is called as holly leaf sign. So we see holly leaf sign on chest radiograph in asbestosis with the pleural plaques which are seen en face. The next important finding on radiology that is seen in asbestosis is round atelectasis. This is a previously asked question in All India 2012, round atelectasis. So they give you a question that a person working in shipbuilding industry presents with cough and breathlessness. CT scan shows a rounded opacity with comet tail sign. So remember that round atelectasis has comet tail sign. Why do we see that is, the features of round atelectasis are, you will see an area of pleural thickening as you see here. So this pleural thickening causes shrinking or atelectasis of the adjacent lung. So this is the area of the round atelectasis of the lung. So atelectasis causes pulling of these vessels towards it. So you will see the crowding of the vessels here. These crowding of the vessels. So the round atelectasis with the crowding of the vessels, that is what gives the comet tail sign, or it is also called as crow feet sign. So this has been asked previously, round atelectasis, comet tail sign, asbestosis. Round atelectasis can also be seen in tuberculosis. Pathologically, what do we see on slide? So we see this dumbbell shaped ferruginous bodies or asbestos bodies. So ferruginous bodies are seen in asbestosis, these dumbbell shaped. So as the term says, ferruginous, so these are asbestos fibers which are coated with iron protein complex, so it stains positive with iron stain. So that is dumbbell shaped ferruginous bodies which are seen in asbestosis. Now, what is the most common cancer associated with asbestosis? If the question is most common cancer and if the question is most specific cancer, so the answer will change. Most common is your bronchogenic cancer, that is the lung cancer, and most specific cancer is mesothelioma. So remember that the most common cancer is bronchogenic or lung cancer and most specific is mesothelioma. Mesothelioma of both pleura and peritoneal cavities is seen with asbestosis. Apart from that, the other cancers associated with asbestosis are laryngeal cancers, CA larynx and CA colon as well. So CA larynx and CA colon are also associated with asbestosis. Now, if a person along with asbestosis, the person is also a smoker, that increases the risk more of lung cancer. So smoking with asbestosis, there is increased risk of lung cancer. So remember these important points about asbestosis. All of these are asked in exam. So we had this question posted on our Facebook group yesterday, that holly leaf sign on chest radiograph is seen in. So the answer is asbestosis that we saw of the pleural plaques which are seen on face. So the answer is asbestosis holly leaf sign. So to stay updated with new questions and the explanations posted, please join our Facebook group and also subscribe to our YouTube channel so that you do not miss any new video that we post. Thank you.